Good evening from Central Pennsylvania. I want to thank our returning listeners and welcome those who are joining us for the first time. I'm your host, Ed Mann, Director of Training and Education for Provident. Tonight, I have the pleasure to introduce Captain Zach Kirsch from the Erwigsburg Fire Department located here in Pennsylvania. I first met Zach more than a year ago at his fire department when I was invited to speak at their junior firefighter cadet program that his department hosts each summer. I had no idea he was involved in autism training for first responders until a few months ago when I saw he was coming to my county to present autism awareness training for first responders. I attended his class and knew within the first few minutes of his presentation we had to have him on our show. I will have the captain introduce himself after I review some information about Provident and what we can do to help your organization and the people who make your organization work. Provident got its start in 1902 as an independent insurance company in the Pittsburgh area. In 1928, they began serving volunteer fire departments with customized blanket and accident health policies. The owners of the company realized that volunteer firefighters were getting hurt doing things for the fire department, couldn't work, and had no income. So they created the customized accident health policies. Today, we provide volunteer combination career firefighters and emergency medical responders with a multitude of programs. We also now offer our accident health policies and special risk policies to law enforcement. Providence has been voted once again one of the best places to work in Pennsylvania. I think we're on our sixth or seventh, 7 consecutive years now. So some of the programs that we offer to first responders, of course, our accident and health program. It offers all kinds of benefits. If you're doing things for your fire department, your EMS organization, and you get hurt, there's benefits there for you. Another benefit of having an accident health policy with us is our first responder assistance program, where the member of the organization and members of their immediate family are entitled to use the first responder assistance program for a multitude of help. We also have a 24-hour accidental death and dismemberment policy, which provides benefits for your members when they're both on duty and off duty. You can also check out our group term life policy that pays a death benefit for somebody who dies, obviously. We also have a critical illness policy, which covers you for a heart attack, a stroke, renal failure, or cancer. And then, of course, our Fire Plus property and casualty program. And if you're a P&C client of ours, you have access to our Fire Plus Academy with over 800 plus courses. It's actually the backside of it is hosted by Fire Rescue One. And something I forgot to mention under our accident health program now, in most states in the country, you also have the ability to purchase a cancer rider for the policy that could pay a benefit anywhere from $2,500 to $100,000, depending on the term that you select, if an individual in your department is diagnosed with cancer. Tonight, as I said, Autism Awareness for First Responders by Captain Zach Kirsch from the Erwigsburg Fire Department in Schuylkill County, Pennsylvania. And I'm going to stop sharing my screen. Zach, if you want to turn your camera on.
Yeah,
So,
absolutely.
Zach, if you would please take a few minutes and introduce yourself to our listeners. And I'm going to turn my camera off and you can proceed with your program.
All right. Hi. Good evening, everybody. Like Chief Men said, my name is Zach Kirsch. I am currently a captain at the Erwigsburg Fire Department in Erwigsburg, Pennsylvania, in Schuylkill County, or the Skook, as those of you joining from Pennsylvania know. This is my 19th year in the fire service. Was career just outside of Nashville for a stint, and then we moved back up here in 2021, where my wife, son, and golden retriever all live, which we'll talk about here in just a little bit. I will tell you a little bit about this program before we start. It was formed last year in September. I'll kind of give you a backstory once we get going. Um, Formed for my son, Noah, as well as others at First Do Autism training who are directly impacted by autism. We saw a need for it for not only first responders, but all of those in the community to be autism aware and how they can help during an emergency situation. And since then, we've reached probably over 3,000 first responders in multiple states. I did see a question about the continuing education. There will be a QR code at the end of the presentation for those that reside or practice in Pennsylvania. Unfortunately, it's only for Pennsylvania right now, as we just got our nonprofit license. So soon it will be hopefully countrywide. You'll just have to scan that QR code when it comes up, fill it out, and then it will send it over to me, and I'll approve that for you in a couple of days. So I'm going to share my screen here. Bear with me, I'm not tech savvy, but we did practice. A special thank you, obviously, Chief Man and Sam, who's behind the scenes doing all the work from Provident. I hope you all enjoy the presentation. It's an open forum. If you have a question, there'll be time at the end, but there will also be three scenarios midway through that I'll be needing participation for. There's no wrong answers. Answer it to the best of your ability. Just raise your hand if you'd like to participate and we'll go from there. So without further ado, I will share my screen, hopefully do it correctly. If Chief, can you see my screen there?
Yep, Zach, we can
Yeah,
see
we
it.
got it.
Okay.
You're good.
All right, perfect. So again, this is First Do Autism training, nonprofit started last September. This is the program Autism Awareness for First Responders. It'll be presented by myself. Usually I have a couple others, but you're stuck with me for the time being. My contact information is listed there. Please feel free to reach out if you'd like to set up a class. Currently, there is no charge for it. And it doesn't matter if you have 10 people or 1,000 people. We will come to you and do that class as long as schedules line up. Best way is email. I'm pretty good at getting emails. If not, the other ladies that help, including my wife, will answer it and let me know to get that to you. But my cell phone number is also there to give me a call at any time. You may take a picture of any of these slides and use them. Nothing's to hide. It's all for everybody's knowledge and to help their communities. So this class is to raise awareness for autism spectrum disorder, or ASD, as you might hear me call it. Please note every agency that is represented in this class tonight or this webinar may have their own policies, procedures, or way they respond to calls involving special needs individuals. Please make sure you follow those. This is an informal presentation, and it was developed by first responders and broken down to a first responder level to assist those in identifying those individuals that are in need specific to autism. And I always have to throw this in there because I don't have a lot of abbreviations behind my name. We are not licensed healthcare professionals. We are first responders that, again, saw a need to spread awareness. And everybody that put this program together is directly affected by autism in some way. Some of that I will share with you. Um, it's also very important to know, which you'll hear me say a couple times, when you've met one person with autism, you've met one person with autism. My son Noah, that you'll hear me talk about multiple times, may be different than Joey or Josh or Ron that you see on the street that has autism. Please treat each person as their own and handle those situations to the best of your ability. So, some course objectives that I hope you accomplish or you feel in this presentation. Number one, recognize signs, symptoms, behaviors that are specifically associated with the autism spectrum disorder or ASD. Understand how autism affects not only communication, but behavior and sensory processing. Learn scene management, de-escalation techniques specific to autism. So that could not only be for law enforcement, that's EMS as well. If there's any nurses, you could use some of those tools as well. Gain strategies tailored to not only 911 dispatchers, which are the front line of an emergency, as we all know, but EMS, law enforcement, and fire responses as well. And then I hope everybody in this presentation leaves with some sort of resource or tool that will improve the outcomes during field encounters. What I mean by that is some of the preventable deaths that are happening in the autism community hopefully responders will recognize early and we can prevent that from happening. Not saying we can do them all, but as a group, I think we can do a couple for sure. So this is just kind of a group poll to get you thinking. You can throw your hand up. I'm not going to call anybody, but if you'll throw your hand up in the in the chat or whatever, if how many of you have responded to or encountered an emergency involving an autistic or special needs individual? What I mean by that is it could be an accident for police officers. It could be a domestic. It could be a welfare check, EMS, a patient, not even just a patient, somebody that's on scene there. So just by a show of hands, real quick, just curious, of those that are in the program, how many of you have responded to a call involving a special needs or autistic individual? Yeah, so quite a few. Obviously, we see that, so it's growing, and I'll touch on that with statistics that I'll share with you in a minute. One thing I like to add about this program is if I say one thing more than once, so if I say it multiple times, there's a reason behind it. Please retain that information. It's like grade school or high school, which as first responders, I can comfortably say we probably all struggled with a little bit. But just make sure you retain that information. Number one, and I'll say it 10 times tonight, if not 12, please make sure that you check the water. If you go to a scene for a missing autistic individual or even just some sort of call that you know an autistic individual is associated with, always, always, always check the water. And we'll talk about that a little bit here in just a minute. So I like to share this. This is just to get your brain going a little bit. One of my co-writers of this program and one that goes instructs with me, paramedic Jackie Ginther. These are her two children, two of her children that are twins. Okay, this is Joey and Allie. Joey and Allie. This is their high school graduation pictures, and then the photos they're holding is from kindergarten when they graduated kindergarten. Now, Allie might kill me for sharing this because she doesn't like this picture, but what we like to ask is who thinks Joey might have autism just by looking at the picture to get your brain going a little bit to see what you know about autism. Okay. For those of you that don't think it's Joey, obviously you think it's Allie. Some common things we get is because of Allie's facial expression in her kindergarten picture. Some other things we get for Joey is how he's staring off and kind of that look in his face in his high school graduation picture there. So it just gets your mind going. I will say Joey is autistic. Okay, he's 24 years old, or they are 24 years old now. He has level one, which back then was called Asperger's. Okay, that now falls under level one autism within the spectrum disorder. It's very simple to see the signs and symptoms if you know what you're looking for. Sometimes it may pose a challenge, but if you know, if you retain and you adapt to the situation, chances are you'll be able to recognize those signs and symptoms pretty early. Okay. So a little bit about First Due's story. Okay. These are the 5 or 6 people that really run it with a few behind the scenes that aren't pictured. Up top is to the left, obviously, Savannah. She is a 911 dispatcher full time. Her brother is autistic. She does a lot of work within the community and schools and our 911 center to form programs, protocols, and things involving autistic callers and autistic patients that you know you're responding to. And what I say by that is questions that you should ask as a 911 dispatcher to help responders going to a call involving an autistic individual. She has spearheaded that. Obviously, top right's me. I'll talk a little bit about me just because Chief and Sam said I had to a little bit. The bottom left is engineer Ben Jones, one of our engineers at Orwigsburg Fire. His stepson Mason is level 3 autistic. He solely relies on his mother Samantha and Ben for his daily life. Okay, it's very, very, very obvious that Mason is autistic and he's at the high level of the spectrum. Okay. Middle, that is Captain Frank McDonough. He is my co-captain at Orwigsburg. He works for a charter school where he is the direct advocate for special needs individual associated also with autism. He helped me write this program, kind of got it off the ground, and was the punching bag force behind the program to keep it going and get it off the ground. To the right, like I said, that is Joey in the middle, and then paramedic Jackie Ginther and Officer Joe Merton. husband and wife, obviously, and they are the parents of Joey. Joe is a DARE officer within his community and also a police officer, a municipal police officer, but he also spreads the awareness and teaches how to deal with autistic individuals on a police scene. Paramedic Jackie Ginther. Spoke a little bit about her. She is a paramedic, full-time paramedic. She took a break because there was no resources for her son when he was diagnosed with autism, and she worked at a place called Jim Jam Therapeutics. What that is a behavioral place for autistic and special needs individuals to get them the help and therapy that they need. She went back full-time as a paramedic a couple of years ago, and she helps me usually with a lot of the classes and goes around teaching. A great resource. So as you can see, everybody in First Do Autism is directly affected by autism in a certain way. And we do that for a reason. We want to keep it obviously homebound and get those feels from not only parents, but responders as well. It's important to have that so that we can share with each other what signs and symptoms you may see. Again, when you've met one person with autism, you've met one with autism. Okay? Little bit about me. Yes, that is my pride, joy, and son Noah. He's 5 years old, and then my wife Tiffany in the middle picture there with him and I. This is my 19th year in the fire service, career and volunteer. It's my 15th year as a 911 dispatcher. I'm still part-time here in Schuylkill County. Went to volunteer state, and like I said, my son is diagnosed with level 2 autism, which is midline on the autism spectrum disorder. He's 5 years old. Um, as you can see, he's a bundle of joy, smiling all the time, great kid, but he has his tics and stims that make it very obvious that he is autistic. And we'll talk about those. A little bit about our journey. My wife and I were going to a date night. Noah was 2 years old, and we dropped him off at my aunt and uncle's house for a just a date night. They were watching him. We went out on our date night. We came home. It was a great, great time. When we got home, my aunt and uncle nicely looked at us and said, "Hey, we'd like to speak with you about Noah." Now, first comment from me is, "What the hell did he break?" Everybody, they're like, "No, no, nothing, nothing. It's just some things we've noticed." First being that obviously he still wasn't talking. Okay, he's a 2-year-old boy, 2.5-year-old boy. He wasn't talking. So what? Well, he stacks his toys instead of playing with them, and then when they fall over, he gets really, really upset and pissed off. Well, he's still just a kid, he's a boy, it just happens. Okay? Then they said he gets fixated on objects and items. He likes to watch the same thing on repeat. Well, now I'm just thinking, okay, he's just a kid, leave him alone. There's nothing wrong. I'm in denial. So we get in the car, we head home. They suggested we get him tested, and at that point, I was like, absolutely not. There's nothing wrong with my son. As parents, we all know we don't want to be told that something is wrong with our child. So a couple weeks goes by, and my wife and I notice these things that my aunt and uncle pointed out to us. And we both agree that, hey, we should probably get Noah tested. So we did. We went to his pediatrician, like, hey, can we get Noah tested for autism? This is what we're seeing. They said absolutely in about 14 to 18 months. Wow. Okay, so those of you that have recently purchased a fire engine, I like to give that example. Noah, autism, we want to get him tested. Great, 14-month lead time. However, you can pay the bill right now and start paying that off. And let me tell you, it's not cheap to have somebody tested. Long story short, he gets tested and he is diagnosed with high level 2 autism. Okay. What that means is it's very obvious to the casual eye that he is autistic and certain things he doesn't do or he's delayed. Right now, he's considered nonverbal. He's talking more and more with that therapy, whether that be sign language or a interpretation device. But he is making great strides, and it's very awesome to see. Something I like to say is his fight is my fight. I think we can all agree as parents, we will fight for our kids tooth and nail. It doesn't matter what or how we're going to do it. Uh, when there's special needs, I like to say it's a little bit heightened because some things he can't fight for on his own. So his fight is my fight. I will go down to the grave and fight for him, but I'll also fight for any other autistic individual, especially that's in an emergency situation. So I'm going to show a short video as long as I can get it to work. I did practice and it did work. Show a short video. This is somebody I met in at a trade show with my normal job now. And I was telling him about my journey. And he said, You know, Zach, you're really down. He said, You're kind of down in the dumps. He said, You need to be positive about this diagnosis. I said, Sir, how can I be positive? Like, you're telling me my son's, something's wrong with him. You're telling me he's not normal. You're telling me that he's not going to be a fourth generation firefighter and all these things. How am I going to be excited? So I'm going to show you this video. I'll kind of give you the wrap up of why this program was created and why we have been traveling all around Pennsylvania and other states teaching it, and we'll go from there. Let's see here. As long as I hit the sound button, we should be good. All right. So this is a short video some of you might have seen before. If you have, we'll talk about it like I said. So how does that kind of circle around, right? So I'm going to pull up the PowerPoint back here, and how that circles around is Jocko was telling me to watch this every morning, which I have done. My wife's like, "Oh my gosh, you're watching it again." But that's my drive behind this. Um, Going out on the attack, making sure everybody is aware so that if when the not will or how, but when the emergency happens involving an autistic individual, we as responders know how to deal with that. I like to show this picture. I don't know if you guys can see my mouse, but it's the bottom right picture of my son Noah and I in front of the fire engine. That was at his IU school fire um, day, and I was going over just some brief things with them. And of the entire class, one child hated fire prevention and fire engines, and I'll leave you guess which one that was. As you can see by the facial reaction there, versus all the other ones where he's smiling. So, little bit backstory. That is Noah, again, 5 years old. He loves Bluey. Please remember that because I'll use it as a resource here in just a little bit. Bluey is a kid show for all you parents out there that I'm sure you already know. But he is a Bluey fanatic. So anything to do with dogs. So why it matters in an emergency situation? Why does autism awareness matter? It plays a very, very vital role in
Hey,
ensuring
Zach,
this.
Zach, are you, did you reshare your screen after the video?
I did. Is it not showing?
Well, we had one comment.
Uh,
If I'm gonna give us a
I seen
thumbs up,
him.
make sure we can still see or you're seeing Zach's screen. Somebody say yes. Okay,
Yeah, I think we're
you
good.
got it. We're good.
Good. Good. All right. So why does it matter? Okay. It plays a very vital role in ensuring the safety and well-being for not only the occupant or the person that is involved in the emergency, but you as a responder as well. Going to a call with someone with autism, you need to heighten that because they're going to grab whatever they can. They are going to fight. They are going to freeze. They are going to run. You never know what you're going to deal with till you get there. So you're going to have to adapt, my favorite word, which you'll understand in a little bit, adapt to that emergency situation, especially with those calls involving those with autism. If you think any emergency call with a subject or person with autism is going to be fast or quick, forget it. It doesn't matter if it's a motor vehicle accident, a search and rescue, you name it, a medical call. It's not going to be fast because you're going to have heightened and differences that you're going to have to deal with. It's crucial to recognize that individuals on the ASD or autism spectrum disorder may face additional challenges, okay, and vulnerabilities during those emergency situations. What some of those are, and what is autism, how it all circles back. Autism spectrum disorder is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, it's best described as a developmental disorder because symptoms generally appear in the first 2 years of life. I told you with Noah, we saw it in year two, 2.5. That's when others started to recognize that there might be some differences or developmental challenges coming. And it's very important to know that autism is a spectrum, and not all individuals are going to present the same way. Now, that's the third time I said it. That's one of those things, please remember, because if you treat them all the same, the outcome of your incident is going to be horrific. Okay. The autism spectrum, social and communication differences, repetitions, tics, and stims, interest and fixations. Noah, they call him the weatherman at school. He likes to look out the window. He gets fixated on the trees moving, the rain, the snow, anything that's moving, and he stands there and watches. They then take that and make Noah show them what the weather is outside by a board at his school. Okay, that's something you might see. They may have other fixations, whether it be their fingers. I don't know if you can see it, but they stick their hands out and get fixated like this and look at their fingers moving. Okay. Executive functioning, their emotional regulation. Okay. You might respond to an emergency, medical emergency involving an autistic person with a leg fracture and they're walking around just fine. Or you might respond to Jackie, son Joey, with a nosebleed and he's screaming that he has a brain aneurysm. Okay. Two totally different things. You're just going to have to figure out what you got there. Sensory sensitivity. Listen, we're all firefighters. We're all, volunteers. We're all paid career, whatever. We like lights. We like sirens, some more than others. Okay. Sometimes you just can't use those like you usually would. Okay. It will make your rescue or make your search or fire or whatever you're going to 10 times harder if that person elopes or runs away because you're overloading their sensory and they are having a hard time dealing with that. You might also get the polar opposite. They love lights, they love sirens, they love everything that flashes and make noise. Two totally different things, okay? So three levels of autism. I told you there were three levels currently right now. Now that could change in a couple of years, that could change tomorrow. I don't know. But right now there's three levels. First being level 1 or high functioning autism. So they need that support. Their social and communication skills and repetitive behaviors are only noticeable without support. So Savannah's brother Ian and Jackie's son Joey are in that bluish purple area. That's where Asperger's is currently at. Level 2, substantial support, social and communication skills, and repetitive behaviors still obvious to the casual observer, even though support's in place. So that's where Noah is. He's kind of in that yellow. However, he goes to speech, occupational therapy, behavioral therapy, physical therapy. Okay, these intense therapies in hope that we can help him regulate and get him down to more of that green area so he can do more things on his own. And then level 3, the highest, severe autism, substantial support. Their social and communication skills and repetitive behaviors severely impact their daily life, meaning they rely on caretakers, guardians, for everything basically that they do. Or they elope, they can't listen correctly, and they, cause a disturbance or things like that. Ben's son, Mason, is kind of in that orange-red area. Okay. Even though he has all that support in place, he's still in that red area and needs a little bit extra help. A couple of statistics. Now, I want everybody to wrap their mind around some of these, especially the one of the last ones I'll share with you all. Number one is 1 in 31 children currently in the US have autism. That's up from a previous rate of 1 in 36. Now, if we were in person class, I would ask people why, give examples why they think, like what's going on. The easiest thing I can say and example I can give is COVID. It's a very terrible example. No matter where we were in the country, it was kind of different. However, the more tests, the more diagnosis. Autism is now a spectrum. More people are getting tested, more people are being diagnosed and put within that spectrum disorder. That's why that number's up, which then turns into the 1 in 45 adults in the US currently have autism. Why is that? Well, when they were kids, nobody knew what autism was. Savannah's uncle, he is an adult now. Back when he was a child, they just thought, okay, he's just a child and he does things a little bit differently. However, now he's falling within these spectrums and he got tested and he falls within that 1 in 45. In the US, 4 in 100 boys and 1 in 100 girls have autism. Again, I like to ask this, but I always get one of the same answers. Well, that's because girls are smarter than boys. Ask my husband. Now, I'm not disagreeing with that. It might be true. It might not be true. My wife is watching, and I guarantee you she is shaking her head. Yes, it's true. However, I'll tell you why in a slide or two why that is. 40% of those with autism never speak. They're considered nonverbal. I told you Noah is currently nonverbal. However, he's learning to speak and say certain things, and he also is learning sign language and how to use his device to communicate. Those are some things you might run into. You're going to have to adapt on how they communicate. So this one's very, very important. These next two, please, please, please retain these two. Those with autism are 160 times more likely to drown than neurotypical peers. 160 times. That is massive. Okay, I told you at the beginning of the presentation, always, always, always check the water. Now, I get people saying, well, why, Zach? Why do autistic individuals gravitate towards water? And it's simple. The movement, the fixation, the pressure when they're in the water, and just the general interest. You might have kids or adults even that go just to look what's going on at a river or a pond or a pool, and they slip and fall in. Well, then they're sensory overloaded and they drown. Okay? Noah is learning how to swim. There's a lot of autistic individuals that have swimming lessons and know how to swim. But when they get overloaded, sometimes they forget, which results in a fatality due to drowning. Okay? 91% of those deaths in children ages 14 and younger with autism are due to drowning. There's your statistics, folks. Always check the water, please. And then no two individuals with autism are alike. One thing I like to share here, there's a multitude of different departments within this presentation or that are attending this presentation. I want you to think how many calls a year you make. And say you're at a smaller company and you make 100 calls a year. Okay? Autism prevalence has increased 384% since 2000. 384%. Now, easy math. If you go on 100 calls and 384% on the rise since 2000, do you think you're going to possibly come across someone with autism during one of your emergencies? I'm going to say yes. That's not only for those with 100 calls, but if you make 20,000 calls a year, then obviously you're going to encounter them a lot more. That's why this presentation is so important. Average age of intervention is 4.7 years old. 5 is the average age of diagnosis. I told you that there's a wait to get tested. There's also a wait for the doctors to read it and diagnose. And then 5.6 average age of diagnosis for girls. Again, I'll tell you why in just a second. If I can tell you to take a picture of any slide I have in this presentation, this is the one. I have this printed and it, will be hanging in our sensory bags and on our rigs very soon. It's also throughout Pennsylvania and at dispatch centers and things like that. This is the autism acronym, and it really hits all the huge bullet points. Number one, A, or letter A rather, approach the person in a quiet, non-threatening manner. You don't want to come guns a-blazing, screaming, trying to get their attention, trying to be their buddy, just, overloading their sensory. Okay? Walk up to them in a quiet manner. Have a nice conversation. Just be like, hi. It's as simple as that. Start that conversation. Understand that touching a person with autism may cause a fight, flight, or freeze reaction. Now, my son is 5, I told you. My 5-year-old is in the 97th percentile in height and weight. Okay? He is a very big 5-year-old, and he is strong when he's not having an episode. However, when he does have an episode or gets overwhelmed or someone that he doesn't know touches him, he's going to fight like hell. And that 5-year-old boy has the strength of a 30-year-old man. Okay? Flight, they may run away from you. Now you're going from having a, say, structure fire and the person runs, now you have a search and rescue. Okay? You're going to have two separate incidents going on. And then the freeze reaction. I'll give an example of an unfortunate fatality that happened, but when a subject got overloaded, his sensories got overloaded, even though he knew what to do, he froze. Okay? He didn't know what to do. He froze and went in what we call the turtle position. Okay? When Noah gets overstimulated or it's too loud or something like that, he goes like this. and hunkers down. You might see that at parades or if you're out somewhere at a grocery store or something like that moving forward, and that might be a sign that that person's autistic and they just need a minute to regather themselves. Don't keep overloading them. T, talk to the person with a calm voice. Pause and wait for an answer when giving directions or asking questions. So don't come in and say, "Hey, what's your name? What did you have for dinner? What's your medical history? How old are you?" Okay? That's hard for a normal person to keep up, like that. And I say normal by the normal of what we know as normal. Okay? I don't like that word, but it's the best way to describe that. However, if you say, "Hi, what is your name?" It may take 30 seconds to allow them to respond, but they're gathering and processing that answer for you. That's why I said these calls will not be fast. I instruct the person simply and directly. If you're on a medical call, can you get mom's purse? Leave it at that. Can you get this? Will you do this? Etc. Very simple instructions, not too complex. S is seek to evaluate the situation as it's unfolding. Get the big picture. We've all heard it since the beginning of our careers or volunteers. Get the big picture. Try and see what's going to happen first. You might not always be able to, but try and see what you have going on first. And then obviously, police, EMS, or even firefighters maintain that safe distance and be able to retreat if necessary to de-escalate the situation. I like to say don't get firearm happy, okay? Sometimes you have to rely on lethal force or tasers or whatever that might be. However, don't automatically go to that. Same goes for EMS. Don't just jump to ketamine, okay? Allow that person to present themselves if they can safely do so for you and themselves, and then try and evaluate that situation as it's unfolding and call for the units you need for backup. So I'll give you just a second. Please take a picture of that slide if you'd like it. Um, and I can send it out to anybody that would also like it. So, men versus women. I like to say, obviously, that's my son Noah on the bottom with his bluey spoon. Again, bluey everything, okay? Up top is Maisie. That is his little friend from school. Now, they are both autistic, but polar opposites, present themselves differently. So I joke with Noah and say, buddy, if you ever marry her, good luck. That's all I can offer is good luck. Men, diagnosed much earlier and more often, may have obvious repetitive behaviors, rocking, hand flapping, spinning. Okay. Noah has a sensory chair where he can just spin and spin and spin and spin and spin and spin and spin, and then he gets up and walks a straight line. So I jokingly say to the Pennsylvania State Police, like when they attend a class, best of luck if you ever have to give him FSTs and stuff, because he's going to prove all of you wrong, even if he just sat in his spinny chair for a long time. They may have higher rates of impulsivity, and they often exhibit challenges with social interactions. Now, I like to give an example of this. My wife and I and Noah like to go on cruises once a year. Royal Caribbean is excellent with autism, and their cruise staff, they go through autism training to know how to cope and deal with that. We're on our way back. We're at the airport, and we're in the TSA line, and we have all of his documents and things like that. And the TSA guy comes up and says, "Is that your kid?" Now, I can be a bit of a smart, you know what, some of the time, and I said, "No, I effing stole him," jokingly. Not the best thing to say to the Miami TSA guy. So of course he squats down, gets like from face to face with Noah and says, "Can you say dada or daddy?" And Noah did his like this. Okay, not a probably a good look, especially because this gentleman doesn't know Noah is autistic. So my wife and I told him, "Hey, he's special needs. He's autistic. He's not going to speak. He's nonverbal." So he goes, "I'm going to have to call my supervisor." So he calls over the supervisor, TSA manager or sergeant, and she comes up, does the same thing. She was very nice, but she got face to face with Noah, and he reacted the same way. We explained it. So she's looking at the document. She's like, I don't know what we're gonna do. Well, I have a tattoo on my arm. You probably can't see it, but it's a picture of grandfather or a stopwatch clock. And, Noah and I are holding hands at the bottom, and there's some puzzle pieces around it. And on that tattoo, it says Noah. 8/28 is the time it shows because that's the time he was born, and then his date of birth is on there. So another TSA agent goes, "Great tattoo. Where did you get it?" And or what is it of rather? And I told him, and the TSA manager says, "Oh, you're good. Go ahead." They let us through due to a tattoo. 2 points to that story because I know some of you are probably laughing. Number one, don't make a someone feel smaller, or don't make a what out of somebody because they're not responding to you how you're used to being responded to. And number two, when you go through Miami TSA, if you want to take a child, apparently all you need is a tattoo. You don't even need documents. So true story. My wife's probably ready to kill me again for telling it, but it's a good example of the social interaction differences. Women diagnosed much later, or it's missed. Why? Because they mask or hide traits to fit in. Men don't care if we're different. Yeah, Chief Man, I'm different than Chief Man. All right, whatever. Now, obviously, I'd like to be like Chief Man when I grow up, but I if I'm not, okay. However, females like to fit in. They don't want to be, different than their best friend. When they go to school, if somebody has a backpack, they're going to come home and say, "Hey, my best friend has a backpack. Well, I want that backpack too." All right, well, then you're going to go out so that they can fit in with that. Because if you don't, they're going to have higher rates of internalized anxiety or depression. We all have some sort of anxiety, and they're better at copying peers and social behaviors. So a lot of you probably hit it, nail on the head. Both are going to have social communication difficulty with reading faces and voices. Preference for routines. Jackie likes to give a example of her son when he was in school. If on his calendar it said they were having chicken nuggets for lunch, he goes to school, they announce they're having pizza. He would physically not be able to stay there or mentally, and they would have to go pick him up because it would ruin that routine. Okay, they all have their preferences. Noah knows his routine when he gets up, and he follows it to a T every day, whether he has school or not. So when he doesn't have school, and my wife and I have to break it to him, then that's a challenge for a couple hours to get him to reset. Okay. Uh, Intense interest, special topics or hobbies, and then heightened sensitivity to sounds, lights, or textures. We all wear very loud, bright, odd feeling things. Just remember that might overload somebody. So some key traits: limited, minimal, or nonverbal is how, certain may be. They may talk a lot, they may talk a little, they might not talk at all. You have to adapt to what that patient has. Avoidance of eye contact, repetitive behaviors, rocking, hand flapping. I told you spinning with Noah. Unusual reactions to sounds, lights, or touch, and then that flat or heightened emotional expression. Some of them might be laughing at stuff that's not funny. Some of them might not show any facial reactions to pain or to anything that's going on. You just have to work through that and deep dive what's going on with that patient. Some stimming examples and risk of those examples. Number one, teeth grinding or chewing. Okay, there's a thing called pica. And for those of you that don't know what pica is, it's eating objects that are not basically edible. We have a boy a couple counties over. He would eat the drywall off of the walls. His family had to put wrestling mats all around the walls, but we would get called out there for him choking or difficulty breathing because of that drywall dust, and he was eating through the drywall. Repeating the same word, phrase, or sound. Staring at visually stimulating objects or a scene. Finger tapping, flicking, twirling, hand flapping. When Noah gets excited and he's happy, his hands go like this. He's constantly hand flapping. We know he's excited. It's his way of expressing it. Tensing or relaxing muscles. I said earlier Noah is in physical therapy. He's in physical therapy because he tiptoe walks and his calves are constantly constricted. It's very important for us to try and get that corrected so that later down the road he doesn't have issues with those muscles and tendons down there and things like that. Fidgeting with body parts or objects, so hair flicking your ears, you might see. Repeating or watching and listening to the same thing. Huge in my house. If you don't know the Bluey theme song, come over to my house for 1 hour. I guarantee you will listen to it for probably about 50 times up to a certain point and it gets restarted. Noah loves it. Different children or adults may present it in a different way. They might like the Friends theme song or whatever interests them, and they might play it over and over and over. Pacing. spinning, and then rocking back and forth. Those are just some examples of stimmings. So how does that like hurt them, or how does that cause a risk? Risk of those can include disruption at school or work, causing physical harm, impacting close relationships, worsening mental health, or medical issues. So, some common medical issues that you might come across with autistic individuals, this says kids, but it could be adults too. 80% of those with autism also have sleep disorders. Jackie's son, he's either on night shift or day shift. That could be huge for a fire call. You go in the middle of the night, you're like, everybody's probably sleeping. Well, that person might be up and they might be out already. Okay. Gastrointestinal disorders, 84% have that. I give an example of my son. For the longest time, he would not go to the bathroom and he would hold it in till he was sick because of the sensation and feeling of having to use the bathroom. We had to go see a specialist. Since then, he has gotten over that, but that might present itself to abdominal pains, back pains, things like that. Anxiety disorder at 40%, ADHD, OCD, or bipolar, 40 to 70%. And then, of course, epilepsy and seizures, 33%. And finally, immune deficiency or food allergies, 25%. That's mainly because of textures of food. Some don't like it. I mean, we all have that kind of thing, like some don't like their food touching, etc. Okay? It's just a little bit heightened for those that are diagnosed with autism. Probably my favorite slide on this PowerPoint. Okay. And yes, I get kind of really behind this slide and I may sound aggressive, but it's meant for a reason. I said my favorite word is adapt. Just because someone is different or has a special need, that should never hinder, affect, or control what level of care or compassion that is given during an emergency response. As responders, we must adapt. Now, if we were in person, I would call on a few people, but I want you to think for my firefighter, my line officers. You respond to a smoke in a structure. However, you get on scene and you have a working fire. Is that going to change your approach? The answer would be yes. Okay. You have to adapt to that new situation. My EMS professionals, if you go to a breathing difficulty, but it turns to a cardiac arrest, are you going to have to change it a little bit and what you might have to treat? My answer would be yes. You have to adapt to that situation. Law enforcement, you go out for a verbal domestic. However, you get on scene and it's now physical. Are you going to treat it like a verbal domestic or a physical domestic? Answer is you're probably going to adapt to that situation and treat it like a physical domestic. Okay. My point is adapting is becoming adjusted to new conditions and altering to make situations more suitable. We have to adapt to those with special needs and treat them how they should be treated because it's not going to be the same as a missing person with no medical history or vice versa or what kind of call you're going to. So why as responders, line officers or whatever you're here as, are we not responding and adapting to that situation involving the special needs individual? And usually I pause there and I just watch the room and everybody just kind of looks around and I get the correct answer, which is we're not aware. And that is true. Another reason this class is so important and why we put it together and have been traveling all over to present it. And it's been so well received. Okay. The little boy on the left, bottom left, that is Christian. He's from Christian's Crayons, which is a nonprofit. He makes crayons and coloring sheets for sensory bags, and which we'll talk about what a sensory bag is in just a few minutes. The little girl up top is Maisie again, and then of course that's my little guy on the right, Noah. As you can see, water is a big thing. Always check the water, please. So a couple of real life examples, and some of these might hit close to home for you, especially because I can't see where a lot of you are from, but I know a lot of states are represented. In 2025, the little boy on the top right, that's 3-year-old Kyrie Larry. He ultimately became a drowning victim at a retention pond when he wandered off from his family's apartment. The police department responded there. They handled it to the best of their ability. One place they didn't check was the retention pond early on that scene. Okay. They went through the entire, complex of where he lived. They ended up finding the little boy in that retention pond. I'm not saying by any means if they were more autism aware that that could have changed the outcome of this. However, there's always that chance, right? Number two, Groveport, Ohio. That's 34-year-old Jackie Price. He was an autistic male who hid during a house fire versus evacuating. Ended up dying of smoke inhalation. For 32 years, he and his family practiced what to do in the event of a fire. They were comfortable knowing that he knew what to do in that event. However, it actually happened. Okay, he got overwhelmed. He went to his safe place and he hid. Um, he ended up passing away of smoke inhalation. The chief got on scene, or first responders got on scene. They walked past the caretaker. They started their search. Okay, caretakers, guardians, and all of the above parents are going to be your best resource for any incident involving an autistic individual. Okay. They're going to know that person best. Utilize them as a tool to help you during that scene. Not saying he could have been saved, but they knew where his safe spot was. And I don't think they searched that till later in the game and found him deceased where he was hiding in his room due to smoke inhalation. Number three, Pocatello, Idaho. 17-year-old Victor Perez, nonverbal autistic male with cerebral palsy, was having a mental health breakdown. The police responded there, handled it what they thought was to the best of their ability. They were yelling his name. He wasn't responding to his name. He responded to different things, lights, sounds, and he came, what they said, aggressively back towards him. He didn't, present himself any way other than a mental health breakdown, and they ended up shooting and killing him. Okay, that one I'm gonna say maybe could have been prevented with the appropriate training. Since then, they go through the appropriate training, and hopefully it won't happen again. Unfortunately, things like that happen all well too often. Okay, and they can be prevented with the right tools and resources in play. One other one I like to share. This was 1 week exactly after I presented this program for the very first time. And this one's pretty close to me. This is 6-year-old Aiden Ha. He's nonverbal. Okay. He went missing on Saturday morning, October 4th, and was unfortunately found deceased on Sunday, October 5th, 2025. It was near Bloomsburg. He eloped out of his house, and they ultimately found him floating down the Susquehanna River the day after, or in the Susquehanna River. Again, he went over, got that fixation, was watching the water move, and probably slipped and fell in, not meaning to, or went to touch it, and that was his ultimate, where he ended up perishing, unfortunately. A massive search involving police, drones, dogs, helicopters, and then the community was also there. But unfortunately, they did not find him in time. Don't get fixated or don't get tunnel vision on a certain area. Spread out, okay? Get somebody near that water. Check that water early, and then maybe do your grid search through the woods or around the house or things like that, okay? It doesn't hurt to stage people by that water area. That's why manpower and having enough resources is very important in that type of incident. So after this happened, this is Pennsylvania State Representative Robert Ledbetter from that county. He introduced what's called the Purple Law. Now, this is in the final stages of being hopefully approved for Pennsylvania. It's very similar to an Amber Alert for abducted children, Silver Alert for elderly adults, Green Alert for at-risk veterans, etc. He believes the Purple Alert um, would help following the recent and what he says as the preventable death of Aiden Ha. Okay? It's designed to rapidly notify the public and law enforcement when an individual with certain cognitive, intellectual, or developmental disabilities goes missing. Right now, that doesn't fall under certain criteria and it's not broadcasted as it should be. He believes that getting more eyes out there in this purple alert system could have got a description, a photo, and a known location statewide, getting more eyes on the scene and around that river and things like that. And he thinks it could have potentially saved a life. I'm going to agree with him. Okay, it doesn't matter what side of politics you're on. We need to do what's best for the communities and the people you serve. Okay. I like to throw that out there because some people bring up that he supports a certain party. Has nothing to do with that. Okay. This class has nothing to do with that. This is for the individuals in those emergency situations and how we can help them and potentially save a life. So that is at its highest level. Just waiting for all it to go through the legal law process, and hopefully it'll be brought up to Pennsylvania soon. So now we're going to break down the different agency types. So we're going to start with the front line, the 911 dispatchers. These are some questions I highly encourage your 911 center to ask if you're not doing so already for a missing individual, especially when you know they have autism. Is this person verbal? How do they communicate? Okay. Text, pictures, pointing. How are they doing it? That will help you help the responder. Do they respond to their name? Why is that important? If you go out on a rescue or if you go out on a mental illness call, excuse me, so you don't have the preventable death where that boy was killed, do they respond to their name? He was yelling Victor, but he wasn't responding. That officer thought he was being aggressive. He wasn't. He didn't know how to respond to his name. Okay. What are their triggers? Sound or touch? What calms them down? Bluey calms Noah down. My golden retriever Rue calms Noah down. Okay. And his mother. I get him riled up and then make his mother calm him down. What are they most attracted to? Water, woods, trains, roadways. Figure it out. Okay? I can only fit two in there, but figure out what they're attracted to. That way you know where to start your search. If you know 100% that they're going to go to the railroad to watch trains, I would probably send one of my crews to walk the train tracks or along the train track looking for them. Okay? And then where is their usual safe space? That one is very important, especially for firefighters. You go to a structure fire and you know their safe place is, say, the basement because it's dark or cool or something like that. You might want to start your VEIS there if you can safely do so because he or she is probably going to be there. Okay. So firefighters. Okay. Scene safety is extremely heightened with autistic individuals. What I mean by that is you have to be very quick. You have to move with a purpose. If you go in to rescue an autistic individual, I told you earlier, they're either going to fight or freeze or flight. Okay. Chances are they're going to fight you if you're overwhelming them. They're going to grab your face piece. They're going to grab the hose. They're going to grab your helmet. They're going to grab your radio. They're going to grab whatever they can get their hands on, which then poses a safety issue for you. Be quick. That's not only for fire scenes. That's for motor vehicle accidents when you can safely do so. Things like that. If you have to scoop and go, scoop and go. Okay? They may fight you, but you got to be quick. PPE sensory overload. We all wear things that are loud, that are bright, that make noises, that are bigger. Some make you look like a juggernaut, that kind of stuff. It's going to overwhelm them. Be quick with them because you're not going to know the reaction that you might get. Okay. Keeping calm during alarms, forced entry. If you can pop a lock nicely instead of kicking a door in, do so. So that person doesn't run deeper into the structure or run away from you and then cause a bigger scene that you're already dealing with. Okay. I said earlier, you'll then have a search and rescue versus, just going in for a fire alarm with smoke in a building or something like that. And then family and caregiver engagement is the number one thing to do on a fire scene. They are going to know that person best and know how to help you best in getting that person, especially if they are hiding. Okay. Law enforcement, recognizing autistic behavior versus combative behavior, avoiding escalation from physical restraint, de-escalation, having that calm presence and take a step back. Joe always says he'd rather talk for 20 than fight for 5. Now, I've not had anybody disagree with that statement, or we have not had anybody disagree with that statement because why not? If you can talk somebody out of it and it takes 20 minutes, then you're not going hands on and it's a better situation for everybody. Know when to disengage and wait for support if the situation allows it. Some counties or states have that support where they can call their crisis responder or they can call a local agency to help them, that they have that resource that is needed. Use it. Don't be afraid to use it. Do not get tunnel vision and think you can handle a scene by yourself because you don't want to be the guy or girl that calls for backup because of this situation. Who cares? Okay? If the outcome is 1,000 times better and you have a life saved versus a deceased individual because of a decision you made, get them on the road early. With that being said, these are some misinterpreted behaviors for those with autism while in a police response, okay? Eye contact avoidance can often be seen as evasive or guilty. No response to verbal commands can be perceived as defiance. Repetitive movements can be mistaken for intoxication or agitation, okay? Running away, or what we call elopement, can be viewed as fleeing from the police. And then that sensory overload may present itself as an aggressive or a meltdown. The best bullet point I have for this slide, and I need everybody to just think for a minute, understanding the difference between defiance versus disability. Now, I'm going to ask for some participation in this, and Sam, I might need your help a little bit because I can't see the
Yep,
hands going up.
I'm
If
here.
somebody could raise their hand and just give me an example, a parent, of your child being defiant and how you would describe it, please do so. What is defiance to you? Anybody?
Or it looks like Margie Gantz. I'm gonna
Okay. Yeah,
allow her to speak.
sure. Margie, go ahead. What is defiance to you?
Defiance for me would be the idea that the child sits down, crosses their arms, and says, I don't wanna, or I'm not going to do something.
Okay, that's a great example. Can I get somebody else to give me an example what a disability is? What your definition of a disability is. Now, please, I can't see you guys, but we were teaching a class in Pennsylvania, and one of the people that were in the class popped their leg off and said, "This is a disability," and all you see is the foot go like this. If you're going to do that, just give us a little warning, if you would, please. So, somebody let me know what disability is to them. There's no wrong answers.
All right, looks like Stefan, I'll allow to talk.
Okay, Stefan, what is a or Stephanie? I'm sorry. What is a or Stefan? Stefan, yeah, sorry. What is a disability to you?
Just make sure you unmute, Stefan.
Can you hear me?
Yep, we
Yep.
got you.
Okay, so it's a diagnosis from a doctor
Okay,
or either like a 504 IEP.
okay. So is it Stephanie? Is that right?
You are correct, yes.
Okay. It was popping up two different ways. I couldn't really see it. So Stephanie, let me ask you this: is there a fine line between someone being defiant and having a disability?
Yes. I also work in the school district as a registered behavior tech, so yes.
Okay, that's very good. So what is an example of a defiance for you in that setting?
So defiant could be refusing to enter a classroom. It could be defiant of doing completing work.
Okay. Great. So, Margie, if you can unmute, would you agree that there is a fine line between defiance and disability?
Absolutely. It's really hard to tell. I worked EMS for 30 years now, in career and tech education, and it's hard to determine if it's intentional or non-intentional. And I think that's the delineation that makes the difference between defiance and disability. It's the intent.
So, I would agree 100% with that. And thank you both for sharing that. So, you have to see that fine line, not only for law enforcement, but EMS professionals, firefighters, you name it. Just because someone is presenting themselves as what might be your child presenting themselves as being defiant might just be that disability. Okay. You have to read how they're reacting and read the room and see what's going on. Because again, it's not going to be quick, but you got to kind of read through that because that's what's going to ultimately help you save that life. Margie, go ahead.
That's truly where the parent or the caregiver comes into play.
Absolutely. Absolutely. Thank you both again very much. So EMS providers, I'm going to jump to the bottom here. Remember, each EMS agency in this presentation or that are here with us may have different protocols, policies, and procedures. Please make sure that you follow them, okay? They're set in place for a reason. However, if you can give some suggestions after this class or what you know to maybe alter those or refine them, it would be good to do so, okay? Remember, consent, vital signs, and touch tolerance are going to be completely different. You might have to think of ways to show and tell. Sensory bags, they're awesome. Okay. You can make one for like $10 from the dollar store or Amazon. Those can be fidget toys, squishy toys, bubbles. You just look up sensory toys, there's hundreds of them. Okay. Ones that make noise, that pull them apart. Show and tell. You can have this if I can do this. Okay. Or you might have to show on their caregiver or parent. Watch, I can do this to mom, and you put a pulse ox on, or you put a whatever that call might call for, okay? Strategies for medical history when verbal communication is limited. You might have to use an iPad. You might have to use paper and pen. You might have to use, sign language, and you might have to get somebody to interpret that for you. You might have to bring that person with you to the hospital, okay? Be ready to deal with that. Their pain response might be delayed or exaggerated. I gave an example of that earlier. They may be walking around with a broken leg, or they might have a little cut on their leg and they are screaming like somebody just cut their leg off. Okay? They're going to present themselves different. The usual using visuals or writing tools, that sensory bag, okay? That iPad that a lot of us carry, your phone, bring along what calms them down. If it's Noah and Bluey calms him down, bring his iPad with or pull it up on your phone or something like that. Adapt to that situation. So how should we use this? Calm and clear, okay? Use simple, direct language and avoid jargon or complex sentences. Reduce the overload. Minimize sirens, bright lights, and unexpected physical contact. Alert dispatch to ensure responders know the individual has autism to tailor their approach if you can safely do so. If you're responding to my house and the first unit on scene says, hey, we have a level 2 autistic male, cut your sirens and cut your lights before you get here, that's going to help the situation versus coming in with all your lights and sirens and him sprinting back into a burning building or running away from the house. Things like that, okay? By asking these questions, dispatchers and first responders can better understand the situation and reduce anxiety for the autistic individual and achieve a safer outcome. Okay, that is the ultimate goal. So, some best practices, the do's: speak slowly, clearly, and calmly. Use visual cues or gestures. Give extra time to process. Allow them to answer you. Ask caregivers for guidance and then minimize sensory inputs. Okay. With the yeses, we also have the nos. Don't touch without warning because you might get your butt beat. You might get assaulted. You might, whatever could happen. It's going to heighten that safety. Okay. Don't use rapid or aggressive commands. Don't interpret lack of eye contact as disrespect. And never assume intoxication as noncompliance. Okay? Or noncompliance, rather. Never assume that. So, this is where the crowd or those attending are going to have to participate. There's 3 scenarios, okay? And what I'm going to ask for is a certain responder from each entity, we'll call it, to handle this situation. I'm going to show you a picture, kind of give you what the rundown is, and then I need you to answer it to the best of your ability of how you would respond to it. I understand that people in California are going to respond different than people in Ohio, than different than people in Tennessee. Okay? Make sure you give the answer to the best of your ability. There's no wrong answers. If I don't learn something from this presentation from you all answering, I'm not doing my job appropriately. After you give me your best answer, I might add a few things. I might not. Okay? And I encourage others, if you have something to add, throw it in the chat if you're not the one answering. So the first one, if I could have a line officer from a fire department, if a couple will please raise their hand. Again, no wrong answers. We're just going to work through it. Very easy. It's just get the brain working a little bit, and I'd like to know how you're going to respond. So, fire line officers, if you guys will raise your hands, we'll choose somebody, and Sam will let you unmute. Any hands, Sam?
Yeah, just got one. Amanda Jones. I'll allow her to talk.
Okay. Amanda?
I have a whole company here.
Yeah. Yep.
Here.
I would, you know what was funny? I remembered your name and I remember you say you were going to have a group. So if nobody raised their hand, it's Evergreen Fire, right?
Yep.
Yeah, Evergreen Fire was getting called on. So, all right, as a group, Amanda, here's your situation. Do you guys have any houses like that in your jurisdiction or around your jurisdiction?
Yes, we do.
Okay, so dispatch number one. So your company is dispatched to reported smoke from a structure. The 911 caller is the neighbor, and they're advising that there's smoke coming from the alpha side window. That's the alpha side window you can see there. Dispatch advises site cautions for a known 9-year-old autistic occupant at that house. Okay. So, as Evergreen Fire, what are some pre arrival thoughts or action plans that you're going to consider if you guys are the first arriving company on this structure fire?
The caregiver or the parent to get information for where maybe this child might be located.
Okay. Yep. Caregiver engagement, always number one. Correct. What else you got?
Advising incoming units to cut lights and sirens as soon as possible.
Yep, that's another good one. Advising them to cut their lights and sirens as soon as they can. Obviously, you can't do that coming across major intersections, things like that. You need to get there with a purpose. Once you get close, cut it. Very good. Next. Anything else?
Safe space was one of them.
Yeah, safe space. Find their safe space. Why is that important? Is one of your chiefs there?
Yes, I have 2 chiefs here.
Perfect. All right. So Chiefs from Evergreen Fire. I'm going to ask you this. You respond to this fire, okay? And you know that child's safe space is on the Charlie Delta corner bedroom. Are you going to start your VEIS on that Charlie Delta corner if you can do so, or are you going to start on, say, the Alpha Bravo corner just because it's easiest to get in?
Probably where the location is the Charlie Delta.
I would agree.
Empire to kind of split and have 2 crews working at the same time. Try to suppress the fire and get the victim out at the same time.
Absolutely. No, I would agree 100%. That's great. I will add to that. I know two of our fire police from my company are watching, and they all have jobs to do. Okay, we all joke about them sometimes, but guess what? They're a huge resource. On a call like this, use them. Put them around the perimeter if law enforcement's not available, and even if they are, because if that child elopes or runs away, they can keep an eye out for them. So yes, that is great. Is there anything else you guys would like to add, or?
Not at this time, but thank you.
Yeah, no, great job. Thank you. Thank you all for participating. So yeah, they hit them all on the head. Caregiver engagement, number one. Always, always, always if they're available. Number two, finding a secondary caretaker. Maybe the next door neighbor knows something about this little boy that's 9 years old that's missing. Okay, that might be in that house. Oh, he likes to hang out at the playground. Okay, we can send somebody to check that. Let me look at the chat here. Stretch a line, put the fire out, should be out in a minute. Improving survivable space. I'd agree. If you can safely do so, right? In your 360, look for colorful, unusual curtains, window decorations that might indicate a child's bedroom if the caretaker's not there. That's huge. Thank you for that, Pat. I would see if a neighbor has a camera. Child seen go out the window. You may be looking in a house when they're already out. It's that simple, folks. It's just like a normal response. However, you just have to tailor because there's going to be some special needs that go into what that child might react to when they see or hear or smell that fire. Okay. All right. So thank you all. Number 2 scenario, I'm going to ask for another fire company or fire department line officer to participate in this one as well, or a law enforcement officer. Any hands, Sam, that you saw go up?
Yep, looks like John Wasco. I'll allow him to talk.
Yeah. Hey, John.
Hi.
What is your role and what department are you with?
So I did a number of years on a fire company as a truck captain.
Okay.
Then I switched over to law enforcement search and rescue, Department of Corrections, and right now I am working on bringing to Jacksonville. I'm currently a wilderness first responder, working with law enforcement, finding missing children and adults.
Well, this is going to be perfect for you, John, because guess what? You're going on a search and rescue, my friend. As soon as I can get my screen to change. Do you have any houses like that within your jurisdiction or that you see down in Jacksonville?
I do, and I work outside Jacksonville too. I work with Clay County, Nassau
Okay.
County. I'm currently a volunteer search and rescue, trying to build a search and rescue department with JSO and neighboring counties to build a volunteer
Awesome.
unit.
Very cool. So we're going to think you're down, we'll say in Clay County, okay? And your department's dispatched to a missing 5-year-old level 2 autistic child. So we'll
Hey, my
pretend it's
son's
my
autistic
son.
level 2.
Oh, perfect. All right. So it's one of our sons, okay? Child's last known location was in the backyard of the house. However, the mother found the side gate open, and the side gate, we'll say, is to the right of that American flag on the front porch. To the south of the residence is a farm with a pond, which we see there, and then to the backside is a main highway into the local community. So, what additional resources, you're the first one there, what additional resources would you consider for this call? We'll start with that.
I would get water rescue involved because there's a pond, and I know autistic children and adults love water. I'd also get a canine unit because the gate was open. I would also call additional local PD, get a grid map out, and I'd also find the mother or a sibling and ask what their habits are and where most likely their spot is to go. But definitely a water rescue and definitely canines and have something to sniff so you can get in that general direction.
Okay, so John, when would you call for those resources?
I would do it immediately upon scene because when you're driving up, you see a pond and you see the side gate open and you see a large forest area. I'd be calling dispatch to go page out a second box alarm or even a third box alarm.
So I would agree with that 100%. And the reason I ask you that is I go to a lot of places that are like, once I get to the incident, then I might send them. Get them on the road early, okay? Especially that water rescue. A lot of places in Pennsylvania rely on different municipalities for a water rescue, and it takes some time to get them assembled and out there. It doesn't hurt to get them going early, and you can cancel.
The neighbor.
Okay,
Mm-mm.
so I
No,
would
it's the
agree.
neighbor.
Is there anything else you would get going, John?
Um, I'd get make sure that you have plenty of resources. I would even get I get a tent set up, search command center set up too.
And where would you put now, if this is your scene, John, from what you can see, where would be a good spot to put that command center?
Command center, I would put it right between the house, right by the steps, and right by the pond area would be a good spot because there's a driveway and that would be a good spot. This way you have plenty of room to turn around in case the child ended up in a different direction. And you can get ATVs if needed to do a wood search, and you can get the boat launched in there, and you can get the divers diving right away.
Absolutely. No, so I would agree with that. Park it right where John said, or down here by the pond so you can keep eyes on it at all times. A lot of people said drones. Get drones up early. If you have them in your community and they're available, absolutely send it. Drone response teams, especially those that have those infrared and thermals on them, 100%. One thing I will add is when you set that command unit up there, John, I just want to ask you this. What is one thing that all vehicles, emergency vehicles, have in it that could be used as a tool for you in this scenario?
Thermal cam.
Thermal cam, what else?
Ooh, boy, it's been a while since I've been in a fire rig.
Well, a police car. Police cars are prime examples for this.
Boy.
How about a PA system?
Yeah, that's yeah.
PA
I'd be
system?
cautious. I would be cautious with PA system just because, some autistic children with level two like loud noises, some don't. I
Mhm.
I wouldn't set on a necessary high level. I do like a medium level,
Sure.
not kind of like between a shout and normal talk, kind of booster amplify your voice. I would have the mother or the father call out to the child. Like my son, he's more attached to me. So if that was my scenario, I'd find out, hey, who's the child more attached to parent wise, the father or the mother? And I get them on the PA system calling their name and seeing if you get a response.
Yep. Yeah, so that's a great point. However, the one for my son, Jorge and Pat both hit in the comments. Play their favorite music, or for Noah, play the Bluey theme song over it.
That's
I can
funny.
tell you,
My son's name is Noah too.
it was meant to be. So with my Noah, if you play that Bluey theme song and he just so happens to be hiding in the woods, you're gonna see his little ass coming down this hill right here and running towards wherever Bluey is. Okay, so use the
Mine is
tools that you have.
SpongeBob.
SpongeBob, Bluey, once you find
Yeah,
out what they like, absolutely use them. Thank you, John. You nailed them all on the head, sir.
thank you.
All right. Last one we're going to go through as a group. Oh, sorry. Did I interrupt somebody? Nope, we're good. All right. So the last one that we're going to go through as a group, I'm going to ask for an EMS professional to please participate in this one. So, do I have any EMS professionals that are willing to participate with us? And if nobody volunteers, I know of a couple that are on here and you might get called on. Any hands, Sam?
Not yet. If anyone wants to raise their hand, I will let them present.
Anybody?
Oh, here's one. Caitlin Smith.
All right, Caitlin.
Hi, I am currently a EMT student. I finished this week, but
Perfect.
figured it may help.
Yeah. All right. No, great. Congratulations on finishing this
So,
your EMT. That's awesome. What state are you in?
Indiana. I am currently
Indiana.
our department's special needs liaison.
Perfect. All right.
Yeah.
So, I highly expect you to have an ambulance like this one the next time I come to Indiana.
I would love that, honestly.
So, all right. So your company, what company are you with?
Cicero Township volunteer.
Okay. So Cicero, you said?
Yes.
All right, Cicero Township Volunteer EMS is sent to a 37-year-old female, unresponsive, possibly not breathing. Okay, the caller is her 13-year-old son, who's autistic, but he's high functioning. While en route, dispatch advises the female is now not breathing, so you're gonna have a cardiac arrest. The caller doesn't understand how to start CPR, so pre-arrivals aren't available for dispatch to help them to get her started. So once you're on scene, and I'll break this down for you, once you're on scene, what cautions must be taken?
For me, I know I've somewhat encountered something like this, but with my day job, I'm a behavior consultant with the state.
Perfect.
So, um, my first thing is the individual, yes, they may be high functioning, but if you go in and do CPR and go in just straight hands on, they could freak out in the sense of, why are you hurting my person?
Absolutely.
That's what would go key to me first. Yeah.
Yeah, absolutely. All right. So I'd agree with that. What additional actions, once you're there, may need to be taken in addition to the life-saving measures of the mother?
For me, it would be walking, I mean, yes, talking everything through as you do it. Yes, it could
Absolutely.
be frustrating, but I feel like it would de-escalate a situation before it even happened.
I would
For
agree.
them, it would ease their mind, and then especially if it's just the her son and her, ask him if he has any other emergency contacts.
So
to get
is there
them on the call.
absolutely. So is there a chance you're essentially going to have two patients there?
Absolutely.
Okay, so resources and getting more manpower or more units there to help would be huge to help, correct?
Absolutely. And I would even go to the fact of if you can get your fire chief on scene, because a lot of them will go through in like Tahoes or Explorers, it would
Hmm.
be less overstimulating than, say, an ambulance or a cop car or something of that nature. Or I don't know what the insurance policies and stuff would be for that, but even somebody that goes personal vehicle, if it's a volunteer department.
Sure. Yeah, it really depends on that area. Are we ever going to transport the mother and just leave that child there?
Absolutely not.
You guys all may be laughing why I asked that, but we went to a department, and I will not say who. They're like, "Oh, we're just going to hot load the mom, and we're going to go. She's in cardiac arrest."
Oh,
Well,
heaven.
let's not do that, okay? You have a job and a duty to fulfill, and that is a crime. So let's not leave the child by themselves. No, that's
Absolutely.
great. Secondary caretaker information, huge. Finding who that is, letting them know what's going on. I like to give an example of Noah and any boy, okay? Mama's boys. If Tiffany is down and she is unresponsive, and somebody is pounding, giving her CPR and trying to help her, but Noah doesn't know what's going on and he thinks you're hurting him, well then he's gonna fight you. Whereas versus if it's me, he'll probably sit there and laugh, but Mama, he's protective of. Okay? Make sure you explain what's going on. Make sure you detour what's going on and maybe give them a simple task. Hey, can you please go get Mom's purse? Where's Mom's medicine? Give them something to do, okay? But still explain everything that's going on. Caitlin, awesome job there. Thank you so much for helping there.
Thank you.
Um, yeah, yep. So some comments for that one. Try to explain to the autistic son what's happening, why certain things are being done to his unresponsive mother. He may want to stay there watching or be removed into another room. Obviously, dedicated provider. Patrick, great job. Dedicated provider to stay with that individual. Okay. Somebody else said they would have someone help remove them from the situation so you don't overwhelm the child. Yeah, all great, great, great things there. So, fantastic job. Try and find what they like. Let them do that. Hey, Bluey's on over here. Give them their iPad and they may pull away. You never know. You got to kind of go with what's going with the situation. Shayna, excellent point. Do not pull the child off if protecting. Give them a task. And as Amber said, distraction is key in that circumstance. Great job to all. Thank you, John and Caitlin, and all those that performed Evergreen Fire. I appreciate you all as well. So just a few local programs. We're on the home stretch here. The Blue Envelope program. A lot of states have adapted to this and have this. And what this is, it's an envelope for nonverbal or autistic drivers. And on the front of that envelope, as you can see with the picture there, it says what to do for that driver so they don't get overwhelmed with what's going on. Keep their hands on the wheel. The officer might shine a flashlight or have a radio or flashing lights on their car. Once the officer gets to the car, let the police officer know they have this envelope. Because inside the envelope is a copy of the driver's license, vehicle registration, their insurance card, and then emergency contacts. Okay? Um, it tells them before moving any parts, ask if it's okay, if they can do so. Hand the police officer that envelope. The most important part of this envelope, which I don't have a picture of and I apologize, is the back. It gives step-by-step instructions to that law enforcement officer of what's going on with that situation. Driver may exhibit this. Driver might do this. Driver may be overstimulated by this. Okay. Open the envelope to see what's going on. Okay. Great program. It's offered in a lot of states. We partner with Lehigh Valley Health, Jefferson Health, which is in Pennsylvania. But that is awesome. You can just search Blue Envelope and find who near you can get you those if your agency would like to participate in that program. Completely free, and your community will love you for it. So, for those of you in Pennsylvania, yes, my face looks red. It's just the lighting in here. It's not really that red. That need continuing education, now's your chance to get it, okay? Scan that QR code, fill out the form that pops up, and then it will send it over, and we will get them all approved. By next week, you should see 2 continuing education hours. Pennsylvania responders only. And while they do that, I like to bring this up. The first step toward change is awareness. This is awareness for everybody because some of you might not have known anything about autism. The second step of where I expect you to take this is acceptance. Accept that you have special needs individuals in your community and respond to them to the best of your ability. Okay? Use the tools and resources that I have given you to help those outcomes. And if there's other trainings available, go to them. Because if you don't learn something in each training, then you're not in it for the right reason. Okay. If anybody needs this QR code, I will get it to you. I'll have Chief put it on the website or something so you can scan it and it'll be open. Or just reach out to me at that email or whatnot. Or at the end, just tell me you can't get it and I'll put it back on. In conclusion, okay, be patient. Please be patient. Always pick up on any early signs during a response, okay? To the best of your ability. Utilize your dispatch centers, okay? Continue to expand your knowledge of the autism spectrum disorder and mental health, okay? If a class is offered, go to it. Just because you took my class or our class doesn't mean you can't take another one, okay? I still attend other autism awareness classes and people look at me like, what the hell are you doing here? I'm here to learn too. Okay. Just like if they were to attend mine, I hope they learn something. Okay. We're in this together. Have cross agency communication to know where you might encounter an emergency involving a special needs individuals. There's a lot of volunteer departments that are here with us tonight. Okay. Don't be afraid to talk to your neighboring departments. Police talk to fire, fire talk to EMS, EMS talk to police, all around, but communicate all that with your dispatch center. I can speak for our dispatch center. They'll put in caution notes. It comes through active or I am responding, says, hey, this is a group home, or hey, this is a hoarding house, or hey, this is an autistic individual lives here. My house says level 2 autistic male lives here, loves Bluey, caretaker information, secondary caretaker information in case something were to happen to my wife and I. And then essentially that information is available for the responders. It's very important that you all communicate because we're all covering for each other at some point nowadays. Okay. The numbers are dwindling. It's no secret in emergency services. My department might cover for your department might cover for Chief Man's department, all around. Okay. Don't be afraid to share that information. Okay. You never know when they'll be there for you. Again, if you come across an autistic occupant, have your dispatch center, we call them county, add a site note if they're willing to do so, and just be the best responder you can be. An example I like to give, especially for finding out what's in your community, we did a sensory-friendly touch-a truck at my company. It cost us absolutely nothing because we grilled some hot dogs. I had the juniors grill the hot dogs. And we had police, fire, tow trucks, EMS professionals. We had all kinds of stuff there in a sensory-friendly environment. We had over 125 kids from multiple municipalities and multiple districts come out. And those parents that were comfortable doing so, we took the information, gave it to the dispatch center, and now our county knows of 100 other special needs individuals within our jurisdictions that will help improve the outcome of an emergency. God forbid it happens at their department. Don't be afraid to do that. Okay. We also sold some autism awareness shirts and then donated it back to a all-inclusive playground for those that have special needs. It's nice that you're doing things for that community, and your community will very much appreciate it. Okay. Just like sharing that you all went through this class. Put it on your Facebook page. Tag first do. Don't be ashamed of it, okay? Because your community's going to accept it, and I promise you they will because I'm getting multiple messages from a lot of different states and stuff because they saw their responders are going through this class, and it is so well appreciated, okay? And I'll touch on that on my very last statement in just a minute. Just be the best responder you can be. I said it live on ABC News. If you are in it for a t-shirt, a patch, or a sticker, then get the hell out. I'm sorry. It's the way it is. Be the best responder you can be for your community served. 3 little things I like to share. We're Disney people. Walt Disney said if you can visualize it, if you can dream it, there's some way to do it. Okay? Give them the opportunity to visualize it and dream it the way they do, and we can adapt to it. Okay? Because what they visualize and dream is considered, here comes that word I don't like, normal. That's what doctors say, normal. Okay? However, what we visualize and dream as normal might be different to them. We need to work with each other and adapt to their needs too. Remember, autism is not a disability, it's just a different ability. Okay? They can do a lot of things we can't, and we can do a lot of things that they can't. We all need to be together in it. And then all you can do is the best you can do. Last time I'm going to say it. I promised I'd say it like 10 times, and this is probably number 12. Always check the water. Please. If you take anything from this class, if you fell asleep till just now or right at the beginning, I said it at the beginning and the end for that reason. Always check the water. Water safety saves lives, and autistic individuals are always going to be drawn to water. Okay? Supervise at all times, stay alert of the water, know their special individual needs, and together we can keep them safe. That includes families, communities, first responders, all of us working together. Okay? My final slide is a thank you. Thank you all for coming out here, okay? I have to thank Provident Insurance for allowing me to present this presentation to you all. I hope everyone took something from it and you enjoyed it, okay? It's not a run and gun and kick doors in and smoke showing and we're going to put the fire out training, okay? But I tried to make it as engaging as possible so that you understand about autism. I thank my home department, Orwigsburg. They help me get this off the ground running and they support me with whatever I want to do for it. I will always give thanks to them for that. And then everybody at First Do. I couldn't do it without them. There's people, like I said, behind the scenes that do a lot of work. I am unfortunately just the face that gets seen everywhere. And it's because other instructors don't want to be seen everywhere. But um, we put this together for you all, for our communities, which leads me to my last thing. Thank you from me, as not a responder, as not the person teaching this program, as a parent. I can't thank you enough for attending to the 170 something that were in here the last I looked. Thank you. The other parents within your communities will feel the exact same way. I highly, highly, highly know. Okay? I feel comfortable knowing that if I'm traveling through Evergreen Fire Department's jurisdiction or any department that is here tonight with us, that you all now know how to deal with Noah in the event Tiffany and I can't, or any child or individual with autism has that emergency. Okay? So again, thank you all very much. I appreciate it. We're going to have an open here for questions. Feel free to ask whatever you'd like. If you are not comfortable asking questions in front of everyone, you can throw it in the chat or you can send me a text, an email, or a phone call, and I'll help you any way I can. And if I can't, I'll get you the resources you can. So on behalf of everybody at First Do, myself, my wife Tiffany, and Noah, if he could say thank you. Thank you all for coming, and I hope you enjoyed the presentation.
Zach and Sam, can you hear me?
I can.
Yes,
Yep.
sir.
Okay. Somehow, halfway through, my computer decided that I was doing something illegal and it kicked me out of Zoom and it won't let me back in. So I'm on my phone right now. So did we go back through the chat or the Q&A to see if there's any questions we haven't answered?
We have not. But yeah, it looks like we have 3 questions in the Q&A. I can ask them and then
All right. If you
yeah,
would, Sam, because I'm having trouble trying to see it
yeah,
on my little itty bitty phone.
absolutely. So Eduardo asked what de-escalation strategies are most effective when we respond to an autistic individual becomes distressed or agitated.
Yes.
Shayna follows up with how can we push for all the counties to adapt to the blue envelope for autistic drivers?
Yeah, so we'll start with the first one, the de-escalation. So my suggestion is find out what resources your area has. A lot of them, I can speak for my area. My county doesn't have anything in place as of right now. We're working to get it in place. Okay. For those of you that know Schuylkill County, we're trying to catch up with times here. We're in the coal region. Okay. However, you go down to Reading and they have responders. They have different tools and techniques available. So my suggestion to that is kind of an open-ended question, and I apologize if I'm not answering it to how you might expect me to answer it. You have to find out what your area has and how you can utilize that for your department. So find what resources you have, find out what's going on with that child. We'll say child because they're all going to be different, and you just got to kind of dig and find out what exactly or how exactly it will calm he or she down. And then to the second part, the blue envelope. So if you, for counties that don't have it, you can, if you're in Pennsylvania, I can help you. Reach out to me. If you're not in Pennsylvania, the best tool you have is Google. If you'll just Google like blue envelope program in Georgia or blue envelope program wherever you might live, chances are some are going to pull up for you. If they don't, shoot me a message as well, and I'll find that information for you.
So, Zach, I see a question here. Is there a list that is good to create a bag? We do
Yeah.
have some at my EMS agency from Autism Foundation. However, I'm looking to create some for my local fire departments.
Yeah, absolutely. Whoever asked that, you can either shoot me an email, a text, or um, a message on Facebook, and I'll send you the list that we have. Just like I said earlier, if you just Google or go on Amazon for sensory toys or sensory things, stuffies, squishies, bubbles, that kind of stuff. That those are all great things, but I'd be more than happy to share the list that we share with everybody. If you just shoot me a message or a text or something like that, I'll get it to you. Not a problem.
So,
Zach, real quick, Ed. Zach, we had a few people comment. If you could go back to that slide with the QR on it, I think
Oh
a
yeah,
few
yeah, sure, sure.
people, thanks, wanted to scan it. And it
Give me a
looks
second.
like someone asked, may I have your email? That's gonna be in our email tomorrow. I'm gonna include Zach's contact information so you can reach out to him. Would love to present this to my own department. Any way to get a copy of the presentation? Yep, again tomorrow. I'm gonna send an email to everyone that has attended tonight. You will receive Zach's presentation as a PDF. You'll receive the link to watch this recording. And Ed always sends out the certificate of attendance in a separate email, so you will be receiving that as well.
Can you see the QR
Um,
code?
yes, I
Okay.
can.
Yeah, I'll leave that
And
up until we leave.
Amber asks, is the training on August 31st the same training? No, it's not. It is a different one, but we would certainly love to have Zach back because this has been really fantastic. Let's see. Is there any? Okay. Scott asked, is there any way I could get the details on the sensory program in our Royal Fire area? I feel this would be a great way to get information and show these individuals that we only look scary. Lol.
Yeah, yeah, absolutely. To answer that, my biggest thing, and usually I'll throw it in there, and I apologize if I didn't. When you go do your fire prevention at schools, include the IUs. It's very important, or the special needs classes. We call them IUs up here. Um, include those classes. You're going to have to tailor your presentation on how you show fire prevention, and it might be literally 5 minutes. You just lay your gear out, let them touch it, let them see it, let them feel it. Don't sensory overload them and keep their attention as long as you can. But that little bit of knowledge will help refrain from them being feared. So we do it once a year. I do it for the IU because other departments they're not comfortable with it, so they ask if I mind, which I don't. But they include them, so just make sure they're included. Same with fire alarms or fire drills. Most times they just take the children with special needs out, and I hate to say shove them in the corner, but that's kind of what they do because they don't want to get them overloaded. Okay, take a smoke alarm in with you. Don't set it off at first. Just show them, let them touch it. Explain generically what it does. Simply, if there's a fire, this will beep. Okay, it's very simple, and they can understand that.
so Zach, I can't thank you enough for tonight. I'm glad that I went to your presentation in person and we moved you up on the schedule as we did. So to answer a lot of the other things I've seen in the chat and the Q&A, I think I'll clear some of this up as we wrap things up here tonight. So first of all, to our audience, thank you for being with us tonight and sticking with us. I apologize. My computer did whatever it did, and I'm having to finish this on my phone. At 67 years old, I'm amazed I was even able to get my phone into Zoom. So I'm going to pat myself on the back for conquering some technology tonight. So I want to also remind our audience there'll be a brief survey we'd like you to complete. Keep your eye open for your email from me that'll have your certificate of attendance attached for tonight's webinar. Again, tonight's episode will be uploaded to providentins.com, and you'll receive that link in an email the next day. Please make sure you check your spam or junk email before emailing me that you've not received your certificate. For those of you who use the webinar as training for a group of people, when you receive the thank you email from Sam for joining us tonight, there'll be an Excel spreadsheet attached. Please use this to send the names and email addresses to us for certificates. It makes it easier for me when I'm doing the certificates. This webinar will be uploaded at www.providentins.com, and that link will be provided in the email that you get from Sam, that you can go back in and replay this webinar, use it as training in your department. If you should happen to use it for training in your department next week, if you send me a spreadsheet with the name and the email addresses, I'll send certificates. Zach's presentation will be in a PDF that'll be attached to the email that you get from Sam tomorrow. And our next webinar is scheduled for August the 31st with a retired battalion chief from the city of Harrisburg by the name of Mike Horst. And he's going to present on fire service rescue culture. Again, I appreciate everybody sticking with us tonight. Zach, you don't know how tickled I am that we were able to get you on as soon as we could. And I do believe before the end of the year, we may even repeat this again.
Absolutely. I'd be happy to do it.
I want to point something else to our listeners. Zach has said that they've gone around not only in Pennsylvania, but in other states and done this program. Just a week or two ago, they got their federal employer ID number. I want you to understand something. He's told you that he does these classes for no charge. So him and the rest of his team have not only done this throughout Pennsylvania, but in other states. And the cost has been out of their pocket for the travel to do these classes. I just want to point that out to everybody. A lot of times people think, these guys get in this to make money. They're not making money off of it. And for almost the last year, they've been running around the country doing these presentations free of charge and paying the expenses out of their own pockets. So I can't thank you enough, Zach, for what you're doing. And for everybody that joined us tonight, please spread the word. Use the video or the recorded webinar and play it over and over in your fire stations and to your first responders. So until we meet again, everybody stay safe for your family's sake.